Welcome to What's New in Pharmacy Programs at URAC. My name is Heather Bonome. I am the Director of Pharmacy with URAC, and I'm joined by Jenn Richards, who's a Product Development Principal at URAC and was the lead on the revision process for all of the programs that we are going to talk about and share with you today. So we're really excited that you're all here. And we're going to go ahead and get started. I want to start off by saying we are more than a little bit excited to be here today. For the better part of a year, we have been working on this project of revising specialty pharmacy and several closely associated programs. And when I say we, I mean the collective we. We at URAC have been working on this, and we have been working with many of you who are on the call today through the comment process and the advisory group process. So thank you so much for the work that you've done. And we hope that you're as excited as we are to learn a little bit more about the revised programs. And really with every version and every revision, we learn how to make the program a bit better. We learn how do we make the process better for pharmacies seeking accreditation and reaccreditation. And it's an opportunity to make sure that the best practices from the industry are reflected in their standards so that patients are getting the best high quality care, because at the end of the day, that's really what it's all about. So I've got our agenda up on the screen today. And before you ask this question, we are recording the session, and we will share both the recording as well as the slides with all participants. Probably in about a week or so, you'll get an email with the link to the recording as well as the slides. But just so you know, you'll have all that at your fingertips. Okay, our agenda for today, I'm going to give a brief overview of URAC and our pharmacy programs. And then I'm going to turn it over to Jenn Richards, again, our product development principal who led this project. I'm going to give her the bulk of the time to really walk through an overview of the revision, the process, where we landed, and to give you a lot more information about that. I'm going to then wrap up with an update to the accreditation process, as well as highlight some of the many resources and tools that are available to you. And then, of course, we will make sure that we have some time for questions before we wrap up today. Okay. So URAC is a national leading accreditation organization. We've been around for a while. We were founded in 1990. We are a nonprofit independent organization, and we validate the quality throughout the healthcare landscape. We are very well known as the leader in specialty pharmacy accreditation, and in addition to specialty pharmacy accreditation, we accredit a lot of other kinds of pharmacies, community, mail service infusion. We also have programs for health plans, telehealth providers, utilization management, credentials verification. So really across the healthcare landscape. You are all here today to focus on the pharmacy programs that we have been working on, of course. So we did just want to show you this snapshot of all of our pharmacy programs that are available. Those that are highlighted in red are those that were part of this current revision process and part of the launch that we're walking through today. We do have a whole host of other programs, again, focusing on infusion accreditation, pharmacy benefit management, pharmacy services accreditation. We do also, on the right-hand side of your screen, have some supplemental designation programs that can be added on to other accreditation programs. So URAC's specialty and mail service pharmacy accreditation programs have been around for a while. We've been doing this for a bit. We've got some experience. We launched the programs in 2008, and over the past 14 plus years, have had the opportunity to review and accredit more than 500 organizations across these accreditation programs. In case you haven't heard, we've just recently launched version 5.0. Of course, you've heard, that's why you're all here today. So we're excited to tell you more about that. And you also likely know that many payers and manufacturers have recognized the value of accreditation and specifically the value of URAC accreditation, and often will require specialty and or mail service accreditation for participation in a network, and or consideration for access to limited distribution drugs. I am now going to transition to Jenn Richards, and she is going to walk us through an overview of the revision.
Awesome, thanks, Heather. Welcome, everybody. Thank you for joining us today. We have a lot of participants. As we move through these slides, if you guys have any questions, feel free to chat them into the box as we go. We'll try to answer any questions that we can through the chat, as well as hold questions that we think would be valuable for everybody. We can answer those towards the end as well. So I wanted to start us off by talking about the 4 programs that we included in this revision process, and the version changes that are happening with these revisions. So we were on specialty pharmacy and mail service pharmacy 4.0. We are moving to a 5.0 version by increasing one major number up means it's a major revision. It means we took a look at every standard, every aspect of the program to ensure its relevancy and to make sure that we were being consistent with the industry. That doesn't mean that a certain percentage of the program changed or anything like that. All it means is that us at URAC included the entire program as part of our review. So specialty pharmacy services also moved up a full version number 3.0, and then rare disease pharmacy center of excellence, previously a designation at version 2.0, is now a certification at version 3.0. Next slide. So we started off with the specialty pharmacy accreditation. That was the main program that was being revised. It included all the focus areas and all of the standards that we felt were appropriate for the other programs as well. All the other programs are associated with this program or versions of this program relevant to the functions that are covered under that accreditation. So mail service accreditation focuses on the distribution and operations aspect of the standards focused on distribution and operations that are incorporated into specialty, whereas specialty pharmacy services focuses on the patient management aspects that are incorporated. Our timeline process was pretty extensive. As you can see, there are multiple steps we take to revise a program, and that we took to revise this program specifically. We started with identifying the main functions, what we wanted to align. We sent out limited industry comment for initial feedback, and then went into advisory group meetings. We held advisory group meetings for 2 weeks, and it was 5 sessions, actually 6 sessions that we held. We ended up adding an extra session because we had so much to discuss. And we really focused on the findings from the comment period through those advisory groups. From there, we took those standards to our pharmacy advisory committee, who approved our standards to present to the board. Our board of directors also approved the standards, and we're now in our program release phase. We're ready to market everything and put everything out there. We have everything ready for purchase and sales. So that's where we're at. It took us a long time. We started in Q1 of this year, and now we're just at the beginning of Q4 releasing everything. So I do want to call out a lot of thank yous for those organizations who helped us revise the program. Our advisory groups that we held through the traditional revision process was only one small aspect of all of the people that were involved in the revision process. So there were people who also commented through our comment period. We had interviews and individual conversations with industry experts. We also have all of our pharmacy advisory council that was involved in this review. And then special thank you to Heather Valentin, our accreditation reviewer, who was very intimately involved in this process and helped keep us aligned with what she was seeing with our clients and our organizations who have gone through accreditation, as well as those who are showing us different things and best practices that she's able to take and relate it over to us as we revise our programs. So special thank you to Heather Valentin. It's a major changes through here. So I want to start with specialty pharmacy, mail service, and specialty pharmacy services as our three major programs that are accreditations that were revised. And these are the ones that are very interrelated, with mail service being distribution and operations focus, and pharmacy services being clinical, and specialty pharmacy incorporating all of that. One of the major changes we made was we moved to a new scoring methodology, the 248 gatekeeper scoring methodology. The front matter of every standards and standards only and guide publication has this included information about the scoring methodology included in it. So please review that, especially if you are coming up for reaccred, and this is a new scoring methodology, so something to keep in mind. We also reduced our accreditation. Oh, sorry about that.
There we go.
We also reduced our accreditation timeline to 6 months. We did this a couple of different ways. So one, we reduced the number of required submissions in each of these programs by about 50%, meaning the number of documents being uploaded into AccreditNet is significantly lower. In addition, we looked through duplicate requirements with state boards of pharmacy and tried to remove those duplications so that there were not additional elements that you were showing twice, both to us and the Board of Pharmacy. For distribution management, we pulled that out as a separate focus area. This is no longer a part of pharmacy operations. We recognized that it is, one, important enough to hold merit all on its own. And two, it is also something that we recognize organizations work really hard to demonstrate compliance with. And we wanted to show that this is a major part of what an organization is doing to become accredited. Lastly, we really wanted to pull all of our pharmacy programs together and make sure that there was complete alignment there. So we did update our foundational focus areas to align with not only just the programs that we've revised through this process, but also all of our pharmacy programs that we have touched in the last year, which includes pharmacy services accreditation, and our PBM program, our pharmacy benefit management program. So we've kind of aligned all of those programs with the foundational focus areas. They are all very, very similar, if not exactly the same. In addition, we updated, again, all of these programs at once so that we could remain consistent across those programs. And we were seeing that organizations who utilize these programs in tandem would have an easier time going through the accreditation program if there was alignment up front. In addition, we did make some pretty significant changes to our rare disease program. Our Rare Disease Pharmacy Center of Excellence was previously a designation, and now it is a certification. We worked really hard to align with specialty pharmacy and specialty pharmacy services, taking the patient management sections, the focus area of those programs, and elaborating on that to really come up with our Rare Disease Pharmacy Center of Excellence certification. The standards themselves within the program are not significantly different. There are some changes, but it's not a huge difference in the actual requirements. Instead, it is more of an alignment with the specialty pharmacy and specialty pharmacy services program and movement into a certification recognition rather than a designation. With the certification, we are moving to a 248 gatekeeper scoring methodology. So while designations are all mandatory and pass-fail, the certification allows for the 248 gatekeeper scoring methodology, which allows us to have the less than full accreditation statuses.
And Jen, just to mention, while we did transition from a designation to a certification, there's still the eligibility requirement of the organization needs to be either specialty pharmacy or specialty pharmacy services accredited or seeking one of those programs in order to be pursuing rare disease. So that's similar. It's more just recognizing the substantial nature of the program.
Yes.
Awesome. Great.
Awesome. So that leads me into our program structures. You will see that foundational focus areas are across all of the accreditations. However, rare disease does not have foundational focus areas associated with it. That is because the eligibility requirements still require the specialty pharmacy or specialty pharmacy services accreditation, which does incorporate foundational focus areas. Specialty pharmacy is the base program. Again, this has all of the standards, all of the focus areas: pharmacy operations, medication distribution, patient services and communication, and patient management. Mail service pharmacy is the operations, distribution, and patient services communication, focusing on more of the medication distribution or medication dispensing practices associated with a mail service. And then specialty pharmacy services, removing the operations and distribution aspects and focusing on the clinical and patient communication aspects. Rare disease has a patient management focus area. It's actually called rare disease patient management, but it is an extension of the patient management standards that are in specialty pharmacy and specialty pharmacy services accreditation. All right. From there, I will pass it back over to Heather, who will take us through the accreditation process and then move into some resources.
Fantastic. Thank you so much for sharing all of that great information, Jen. Really appreciate it. One of the things that Jen mentioned is that the timeline for the accreditation process has been revised for these versions of the program, along with the revision. And I wanted to spend a little bit more time talking about that today. Fundamentally, the accreditation process remains the same. You likely have seen this graphic before. All of the steps remain the same. If you're seeking accreditation or reaccreditation, clients will upload their application. URAC reviewers will conduct a desktop review, including the request for information process. We will conduct the validation review. Our volunteer accreditation committee will render a decision, and there will be ongoing monitoring. So this all remains the same. Over the years, and we've really heard a lot from you, that you felt the process took too long. And so we took a step back and said, how could we shorten the review process? Keep the rigor, but shorten the review process. And we said, okay, the first step really is to streamline the standards. Jen talked about the fact that we've reduced the number of submissions or uploads for the application, and that's really the scorable elements. We did that by streamlining the standards, ensuring that they're all written in clear language. Again, looked through from a duplication perspective, right? For pharmacy, for example, were there overlaps or places where our standards overlapped with the Board of Pharmacy, and was it really necessary for us to be reviewing that as well, when it was very standard for the Board of Pharmacy to also be looking at that? And if that was the case, we could remove those. So just making sure that we have rigorous standards that are specific to the practices of pharmacy that we're accrediting, and that they're developed and offered in a streamlined way. That allows us to shorten the timelines for accreditation, both for the application submission as well as for the review process. So this is what the timeline looks like for these revised programs. There's a 2-month timeline for submitting the application for review, and 4 months for URAC to conduct the desktop review, validation review, and to render the decision. This is something we've already implemented for several other URAC programs. For the last year plus, every program that has been released as a revision, a new program or revised programs that we have released, have followed this same process. we have streamlined the standards in a way that has allowed us to shorten the accreditation timeline to what you've seen here. Now, we recognize that this is a change and that some of you may have some considerations that we will need to work through with you. The good news is you all have a client relations manager and they know you really well. So perhaps you are an organization that takes some time to work through the contracting process. And sometimes that can take a little longer with some organizations than others. Your client relations manager will work with you if you're coming up for reaccreditation to make sure that you have time to contract for the reaccreditation and then to upload your application and for us to complete the review process. So again, we have experience with this and your client relations manager will help you work through some of those considerations. But we're excited to roll this out and we really think that the streamlined process will work really well for both URAC as well as for applicants. Okay, I'm going to move on to highlighting some resources and support tools that are available to help you learn even more about the revised programs. I'm going to start out with the Client Information Hub. So all URAC clients, and that is if you're a currently accredited organization or if you're an organization that is currently seeking accreditation for the first time, you have access to the Client Information Hub. And so if you're not actively using the hub, I'd like to suggest that you go ahead and log in because there's a whole host of information there. And you can just go to clients.urac.org to log in. There's a host of resources, resources like webinars. We have standard specific webinars. We have webinars on policies and procedures, the accreditation review process, lots of good information. We have other helpful tools like tips for how to prepare for a validation review, tips from the reviewers as to how to cite and upload your application. There's staff bios for the client relations managers as well as the reviewers, frequently asked questions, just a lot of really good resources that can help you on your accreditation journey here. On the Client Information Hub, I want to highlight one area specific to this revision. We've recently launched webinars or videos, a 4-part series on the revised pharmacy focus areas. So the 4 focus areas that are specific to the pharmacy programs that were revised: pharmacy operations, medication distribution, patient service and communication, and patient management are now available if you log into the Client Information Hub. Heather Valentin, who's one of our pharmacy accreditation reviewers and who Jenn Richards called out a little bit earlier because she worked so closely with us through the reaccreditation process, has recorded each of these webinars. She walks through the intent of each standard, what has changed, and what URAC is looking for from a demonstration of compliance perspective during the desktop review as well as during the validation review. And in addition to these pharmacy program specific webinars within the Client Information Hub, there are also trainings on the foundational focus areas. We offer live webinars. There are trainings on our AccreditNet platform as well. So really just a whole host of educational resources that are available to you when you log into the Client Information Hub. Now, we do recognize that we had some friends of URAC, not clients of URAC, on the webinar today. And so where can you find some more information? The URAC website, just urac.org, has a lot of information as well. The standard is at a glance, which I see have been also linked in the chat, are available on our website. You can also purchase the standards only on our website as well. You can go in and purchase and get a copy of the standards there. We've put together some other resources that are posted there too, some program overviews. Are you ready? The Are You Ready resources are some of those really key fundamental functions that are required within each of the programs to say, hey, are you ready to pursue specialty pharmacy accreditation, or are you ready to pursue mail service pharmacy accreditation? So those resources can be really great. The Client Information Hub, of course, is a great resource. I've already walked through several of the things that can be found there. The one thing I want to highlight here too is starting on Monday, October 24th, clients are going to have access to a link there. We know that many of the pharmacies that are currently accredited under version 4.0 are eager to understand and prepare in advance for the version 5.0 standards. We think that is awesome. We love proactivity. So we're putting together a process to make the revised program guide as well as the crosswalks available to you. So you would be able to log into the link and request a program guide and corresponding crosswalks for the revised version of the program that you're currently accredited for. And then I also just want to call out AccreditNet is always a resource to you. Within your shared document library, you will always have access to the current program guide, the crosswalks, glossaries, AccreditNet user guide, and more. So there are some organizations that have already have an open application for the version 5.0. They got in there really early when we launched it. And so if you have an active version 5.0 application right now, your shared documents library already has the program guide there, the crosswalks, and the other resources that you would need to make sure that you understand the requirements for compliance with the revised program. Okay. Very good. And with that, we can move on to questions. I've seen a lot of activity in the chat there. So Jen, would you like to help to facilitate some questions for us?
So yeah, let's kind of start with some of the basics. There's a lot of chatter about when you have to move to 5.0 accreditation. So if you are currently accredited under 4.0, when does 5.0 become available? When do you have when do you no longer have a choice between 4.0 and 5.0? And what does that mean for coming up for reaccred? How does compliance with 4.0 standards work?
Okay, so if you are currently, whatever version you are currently accredited under, you will maintain compliance with those current standards until it is time for you to seek reaccreditation. And then whenever it is time for you to seek reaccreditation, whatever the current version is, we're going to assume that that's probably 5.0, but who knows, depending on your current accreditation timeline. Then you will sign a contract to pursue reaccreditation. And then as of the date that you submit your reaccreditation application, that's when we'll look for the beginning of compliance with the 5.0 standards. Now, there are certainly going to be standards that haven't changed because we didn't change anything just for the sake of changing it. There were a lot of really good, solid standards that remain the same words, same verbiage, all of that. And so we'll just look for continued compliance with those when we go through the reaccreditation process. But if there is a new requirement, we will look for compliance with those new requirements when you submit your application for the revised version. So when you submit your application for version 5.0, you don't need to comply in advance of that. If there's a new requirement and you want to start working on that already, by all means, that's fantastic, go for it. But URAC is not going to look for compliance until you submit your reaccreditation application.
And is anybody allowed to sign a contract for 4.0 anymore?
So we've launched 5.0, and that is the version that we are signing contracts for and reaccrediting under now.
Perfect. So for crosswalks, what crosswalks are available? And will there be a 3.1 to 5.0 crosswalk?
As the author of the crosswalks, I'm going to let you answer that.
Perfect. So right now there are three different crosswalks that are posted into AccrediTnet and that are available for request come 10/24 using the client portal or the client information hub. So one of them is a 4.0 to 5.0 crosswalk. One is a 5.0 to 4.0 crosswalk. So we went both ways so that people who think one way or the other have an opportunity to use whatever crosswalk works best for them and how they're organizing their own internal operations. We also have another document that lists all of the standards and elements that were removed from the 4.0 standard to the 5.0 version. There is not a 3.1 to 5.0 crosswalk, nor do we have any intention of making one currently. Right now, we do have a 3.1 to 4.0 and all of the 4.0 to 5.0 and 5.0 to 4.0 crosswalks. So right now, that is what is available to be able to coordinate from 3.1 to 5.0. You know, if we see a significant amount of requests where the effort to make that crosswalk is there, that's something we can consider. Right now, we're kind of seeing just a few, maybe 10 or so applicants who would need that out of our almost 300. So right now, that's not on the books. That being said, if you guys do have any questions, please feel free to reach out to CRMs if it is something that is, you know, more of timeline and how to use our resources. And then from an actual question perspective, we do have the interpretation portal that is wide open for anybody who has questions about 5.0 or conversion from 3.1 to 5.0. Those are things that can be sent through that portal if there are questions about standards.
Sounds good. Awesome. What do you got next?
So most of the other questions I think we have covered with just those two topics in general. There is a question about, are we allowed, so do we have an option to go straight to 5.0 if there has been a signature within the last month or so for either 3.1 or 4.0, sorry.
Got it. So if you've recently signed a contract for 4.0 and you have not, started to work on your application, you haven't submitted your application, and you think you might want to have that updated to 5.0, that's something you can reach out to your client relations manager and work through with them. If you've already submitted your application or started to do work on your 4.0 application, you really need to continue with that. But if you haven't started the work, you probably started the work, but if you haven't submitted your application and you haven't started working through the desktop review process with URAC yet, then there is the opportunity to transition you to the 5.0, but your client relations manager can help you to determine if that is an opportunity for you or not, and if it is, can help you navigate that process.
And then last question that I see, what additional educational resources are going to be available in the future?
Mm-hmm. So again, there's a lot available right now. Particularly, I love, Jen, when you were talking about the crosswalk, and there's the 4.0 to 5.0 and the 5.0 to 4.0. Different people think different ways. And so we wanted to make sure that that was put together for different kinds of folks. We have the accreditation guide available for current clients to look ahead and become familiar with the new requirements, because some want a guide to study, to read the standard, to look at the interpretive language, and then look at what is available there. Some do better by hearing. So that's why we've created the webinars, where Heather Valentin is walking through each of the standards and what the intent of the standards are. So we put a lot of things out like that. We are also working on planning for early next year an in-person workshop, at least one in-person workshop that will be focusing on the standards. There's like all day long, get to talk through the standards all day, super, super fun deep dives. But they are really a lot of fun. And so we will be looking to put those together as well.
Yeah. So a couple of housekeeping items. We kind of have gone over this with the client information hub. Everybody, please make sure that you work on getting access to the Client Information Hub if you don't already have it. This is for our current clients. So please work to get access to that if you haven't already done so. The link to request the guide and the crosswalks will be on the Client Information Hub on October 24th. And that is how you will request the 5.0 standards as a current client. If you have not signed a contract for 5.0 already, therefore you do not have access to CreditNet. Because if you've signed a contract for 5.0, you have access to all the resources in a CreditNet and the Client Information Hub. If not, then you will need to request the information through that link so that you can gain access to the guide and the crosswalks. For those people who are seeking accreditation under 5.0, you will not need to submit all the documentation from 4.0 or prior versions when you submit your desktop under 5.0. You will submit only what is requested standard-wise for 5.0. Our look-back period is 3 years. So any organization that any standard that is the same across programs, you'll be looking across all 3 years for those standards, which is the majority of them. But those those standards that have dropped from the program, you will not need to submit documentation to demonstrate compliance on desktop with those standards.
That's great. There's a question here that if we were recently accredited under 4.0 and say that there was a standard that is no longer part of 5.0, are we still responsible for maintaining compliance with that? And the answer to that is yes, because you sought, or any organization that sought accreditation under the 4.0, that was the program for which you were reviewed and committed to demonstrating compliance for. So for the accreditation cycle for which that is applicable to you, you will maintain compliance with 4.0. And then when it comes time for reaccreditation, that program that is currently available, assuming it'll be 5.0, is what you'll focus on.
So the difference between 4.0 and 5.0, when we remove standards, it's not because they're unachievable, unattainable. They're still very much relevant to the industry. The difference really is that some of those standards we were asking for the same thing as the Board of Pharmacy. And so you were submitting things twice instead of just once. And other times it was because we recognize that the industry is moving in a different direction. That doesn't mean that the standards are unachievable or unrealistic or anything like that. It just means that as the industry continues to move forward, we want to make sure that our standards remain relevant in the industry moving that way.
Mm-hmm. Great. I see a question that says, can you repeat the location on AccrediTnet 3 where we can find the standards, revised program guide, and the crosswalk? So for whatever application you have currently, if you currently have an application under 5.0, then you can go into your login in AccrediTnet 3, and then along the top of your main organization page, there's going to be a Documents tab. You go to that Documents tab, go to the right-hand side, and there's another link that's called Shared Library. That's where you'll find your accreditation guide, your crosswalks, and a host of other resources that can support you through the accreditation process.
As far as look back period, I mentioned 3 years when I was talking about going from 4.0 to 5.0 because a lot of the standards are exactly the same. Our accreditation cycle is for 3 years. So organizations coming up for reaccreditation, that'll be the full 3-year look back period for a majority of the standards. If there's a new standard introduced, it'll be from the time you submit your application under that new version that you are held accountable for that standard. For new clients, it's almost like everything is new. So it's from the time that you submit your application for accreditation that you will be held accountable for compliance with the standards under that version.
All right. See anything else in there?
It looks
It
like
looks like we've done a pretty good job of handling most of the questions there. We thank you all so much for joining us today to learn a little bit more about this. Again, there are many resources available to continue learning. If you have questions for us, you can reach out directly. You can reach out to your client relations manager. The Client Information Hub has so much information for you as well. So thank you again for joining us today. Thank you for your interest in pharmacy accreditation. Thank you again to those of you who helped to participate in the revision process. We cannot do this without the help of the industry experts that provide us with the content of our standards. So thank